Sequence of putting on PPE. Personal protective equipment or PPE is clothing worn to reduce exposure to risk that might result in significant workplace diseases and injuries. Contact with chemical, physical, electrical, or other job hazards may cause these wounds and illnesses. Items like gloves, safety goggles, shoe covers, head cap, vest, and full body suits are examples of personal protective equipment. Personal protective equipment must be designed and built safely, and it must be kept in an hygienic and dependable manner. It should be snug enough to encourage worker use. Fit issues with personal protective equipment might mean the difference between being safely covered and being dangerously exposed. Employers are required to provide personal protective equipment to employees and oversee its correct use in situations where engineering, work practice, and administrative controls are impractical or insufficiently protective. Donning of PPE. First step is to gather all the materials needed, which are isolation gown, head cap, goggles, face mask, and disposable gloves. Next step is to wash your hands with clean soap and water for at least 1 minute. Then, put on isolation gown, making sure to button all the buttons. Then, put on face mask. Extend the face mask under your chin, protecting both your mouth and nose. Hook the loops around your ears. Put on face shield or goggles. Put on gloves and pull it down. Make sure that they cover the wrist of the gown. Lastly, put on head cap. Doffling of PPE. Remove and discard glove using glove-in-glove technique. Pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the used gloves. And perform hand hygiene by using alcohol-based or hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrist where the edge of the gloves was located. Then, remove your isolation gown and snap all buttons. Pull or roll the gown down away from the body and dispose of the used gown. Then, remove your head cap. your goggles. Unhook the straps of the mask from your ears and pull it away from your face and discard it. Once again, perform hand hygiene after removing the face mask. You have now completed the doffling procedure. Steps in hand washing. When a sick individual sneezes, coughs, or talks close to you, bacteria and viruses can readily spread. Any viruses on your hands can enter your body through the mucous membranes in your eyes, nose, or mouth. When you rub your eyes, touch your nose or mouth or both. One of the simplest and most crucial things you can do to maintain your health and prevent the spread of bacteria and viruses is to wash your hands. First step is to wet hands with clean water. Then apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Rotational rubbing backwards and forwards with clasped fingers or right hand in left palm and vice versa. Rotational rubbing of left palm clasped in right palm and vice versa. Then rinse your hands with clean water. Then dry hands thoroughly with a single-use towel. That would be all. Thank you.